Hi, everybody. Welcome to the Dutch live stream. You got Eddie the Corgi here with us.
It's so cute.
The founding dog of Dutch. And we have Dr. Kay Elden.
Hi there.
Eddie's going to be here.
Eddie, you're the star of the show today.
We have our promo code for you, Eddie. Eddie50. If you go to Dutch.com. Okay.
Uh-oh, Joe, you went on mute. Technical difficulties. I'm Dr. Kate Eldon. I'm the Chief Medical Officer at Dutch, and we are here for our weekly live stream.
So today we're going to be talking about all kinds of topics, answering your questions, and you can go to Dutch.com and check us out using promo code EDDIE50. That's EDDIE 50. And we're going to be taking your questions. So the first thing we want to talk about is, what is Dutch? I mean, before we get into that, like, what is Dutch? What do we do? We're an online veterinary care platform. So you can come to us with questions about flea and tick medication, pets' anxiety, and all kinds of special situations that we'll get into. The cool part about Dutch is that we have locally licensed veterinarians all across the country. And when you talk to a veterinarian, you establish something called VCPR, the vet client patient relationship. And I'm going to let Dr. Kate explain what VCPR is.
Yeah, and that it's an important part of every time on the Dutch platform, when you become a member and you log on and you have a video call with a real live vet, then you are establishing this relationship. And it means that the veterinarian is saying, hey, I'm going to take on care of your pet. And the pet parent is saying, I want you as a veterinarian to take on care of my pet. And hopefully your dog or cat is also a willing participant in the relationship. And then that relationship allows the veterinarian to be able to prescribe, to diagnose, and to take on the care. I think sometimes pets are a little bit more happy about establishing VCPR through telemedicine because it spares them the car ride of having to go to the vet, and they don't have to sit in a waiting room. They can establish this relationship over video through an appointment with Dutch without ever having to leave their house.
What do you say, because telemedicine for pets is so new and not every state allows you to establish virtual care, or the VCPR virtually. What do you say to those folks, or even some customers, potential customers who might say, my dog can't talk, how does this even work? Like, what do I do? With humans you can talk, but dogs can't talk.
Yeah, I chuckled to myself a little bit because I went in for my own doctor's appointment yesterday morning, and on the board where they have their workflows, they've got appointments, check-in, delayed, and telemed in there, showing that like telemedicine is a regular part of their everyday workflow. So it is the case in humans, and a lot of us have had telemedicine appointments with our own physicians. But when it comes to pet parents, there's still some skepticism. Not for everybody. A lot of people are already really understanding how it can be useful. But I myself, before I started doing telemedicine, I didn't really understand what it was. And then during the pandemic, I was doing telemedicine all different ways, through chat-based and through video. And at Dutch, we're doing video calls. I mean, each time a member logs on, they're assigned to a specific veterinarian that's licensed in their state, so an expert in their area. And a lot of what we do as vets is history taking. We get information before the appointment. We love it when pet parents send us in pictures or videos or lab work. Things like that can be really helpful. So the veterinarian that logs on is already prepared with any information that the pet parent has given them. And if you've been a member at Dutch for a while, we've got all of your medical history, and our veterinarians are getting a summary of that. And then we walk pet parents through how to do virtual exams. So we will have pet parents put their pets up to the camera. We'll walk them through how to look in the ears, how to kind of feel the belly. We do a lot of observing pets in their natural habitat. And that's something that's really special and unique to telemedicine. In the vet clinic, you don't get to see pets in their like normal comfort zone. A lot of the time their adrenaline's high. So for things like behavior issues or lameness, if they're limping or sore, when that adrenaline's going, like they're a different pet. And I hear so often in the clinic, pet parents are like, they were limping, I swear, or they were hiding and hunched at home, and you just don't get to see that in the vet clinic, but you can see that virtually.
Totally. I mean,
So
I can tell you, Eddie, he knows, he can smell that we're at the vet, and he gets so tense. His adrenaline is already high. He's already,
yeah,
ready to guard, but he is so, and you saw him now, he's at home. This is like his environment. He is a lot more calm, and you can actually examine him and see what his demeanor is like in this natural environment. I imagine for cats, I don't know if it's worse, but I can see, a cat becomes a different beast in a vet's office.
Yeah, and actually, I was just talking with one of our boarded specialists, Dr. Christopher Pockle, yesterday about this, and we were talking about how telemedicine is inherently fear-free, and cats are a good example of that because, in veterinary practices, the pets are often scared and nervous about being there, and there's a lot of effort to think about how do we reduce that stress and anxiety. And the fear that they have. And telemedicine is definitely one way to do that. And he used the example of like, well, there's trade-offs with everything that we do. With telemedicine, we're not getting lab work like blood work. We absolutely can do like fecals and urine, but we're not getting blood work. But the trade-off of that, does it make sense to bring a cat where like maybe it's really hard to get them in the carrier? I had a cat that was really hard to get in the carrier. Like he knew the day before the veterinary exam and would hide, and put them in the carrier, and then they're stressed out. Maybe they like pee or poop in the car ride on the way there, and they're stressed out for the exam. Like, so is the trade-off of that worth it? Like, sometimes the answer is yes. If we're suspecting a disease where we really need blood work to confirm, but sometimes the answer is no. And so, so telemedicine is really helpful for those scenarios when pets don't actually need to come in for the video visit or don't need to go into a clinic.
Yep. Okay, let's get to our questions. We're in the middle of flea and tick season, and we've got a ton of questions from our audience about flea and tick. The first one is from Mercedes Leon. Can you get prescriptions for Simparica Trio? I'm tired of taking my dogs for a checkup and paying an arm and a leg just to get a prescription.
The answer is yes, definitely. We can prescribe flea and tick medications, and each time a veterinarian prescribes a flea and tick medication, it's a personalized plan based on your area and what they're most exposed to. But we can absolutely prescribe those through Dutch.
Cool. Okay. Are you able to prescribe oral flea and tick medications without having to go to a vet in person?
Yeah. Yes. The answer is yes, absolutely. And I like this point of, because there's different types of flea and tick medications. There's oral and there's topical. And this comes back to making a personalized plan for your pet specifically. There are areas of the country that have really high tick populations, like the Northeast we are seeing a lot of ticks in that area right now. And your veterinarian might even prescribe an oral and a topical, because they work differently. The topicals, some of them can repel ticks from landing on pets. And then the orals will kill a tick or a flea when they bite. So absolutely we can do that. And I think the most valuable part is having a conversation with the real vet at Dutch, where you're getting a personalized plan based on your pet, specifically any conditions they might have in the area that they live in.
What kind of flea and tick meds do you prescribe? This is a question from Brandy Brown. Do you prescribe the pills? Where would the script get filled?
Yeah, we have all the different varieties of flea and tick medications. To name a few, Credellia, Credellia Quattro, NexGard, NexGard Plus, Simparica, Simparica Trio, Bravecto. We've got them all. And the same for cats. We've got Revolution and Credellia Cat and NexGard Combo. So you can order those straight through Dutch if you want to. Just like disclosure, at any veterinary clinic, anywhere you go, you can ask to get your medications from anywhere. So also, from Dutch, if you want to get your prescription filled somewhere else, you can absolutely do that. We can transfer the prescription, we price match.
You have a 20% discount on flea and tick.
That's right. Thank you.
Flea tick 20.
Yes.
Okay. Our last flea and tick question from Sean Starr. I don't see flea and tick treatment for cats listed. Are cats also covered for that?
Yeah, definitely. And we want our cats to be on flea and tick preventatives as well. I mean, I think about that a lot. I'm seeing a lot of cats and kittens. It's kitten season right now, and we want them to also be on flea and tick preventatives. And there's orals and there's topical flea and tick preventatives. I have some family members that are looking after like feral and stray cats in their area, and they are asking for the oral cat flea and ticks because they don't think they'll be able to handle them and put a topical on. So another, personalized conversation with your vet to get the right product for your cat.
Yep. And you can always email care@dutch.com if you're not seeing something that you're used to, or of course, sign up at dutch.com and schedule a call, and your vet will be able to create something customized based on your situation. Moving on to allergies and skin issues. This is a question from Edward Morgan. He says, my dog is constantly scratching and has lost a lot of hair. No visible fleas. Is this something that can be diagnosed and treated via online vet?
Yeah, I think an online vet is a good place to start. And there is some skin testing that we can do virtually, and we're working on building more. But absolutely, sometimes there's an underlying cause to the itch. And so we would talk about making sure your pet's on a flea and tick preventative. We can also give a medication that helps resolve the itch. A medication like Apoquel or Zenrelia or Numelvi can all help reduce the itch. Sometimes fleas are present. I will say sometimes fleas are present even if you don't see them, because pets are really good at grooming them off. But sometimes there's an underlying infection, whether it started with fleas or started with something else. There might be an underlying infection with bacteria, yeast, or mites, and we can treat those things virtually as well. At some point, if your pet's not getting better, then we would talk about seeing a vet in person. But starting with, if your pet's otherwise healthy, starting with a video call makes a lot of sense here.
I love all these questions that we're getting. This is our 4th episode now for doing the Ask a Vet Dutch live stream. And we're here every Thursday. And if you want to submit a question ahead of time or on any of our platforms today, please do. And we'll have our Chief Medical Officer, Dr. K, answer them. Last allergy question. My dog is currently on 2 doses of Apoquel, 16 milligram and 3 milligram. Can you help with that? I'm not sure what the question is.
Yeah, I mean, Sergio, you must have a very big dog. getting the 2 different doses of Apoquel. But yeah, absolutely. I mean, we can refill Apoquel prescriptions. We can talk about Apoquel, or if you feel like the Apoquel isn't working as well as it used to, we can talk about switching to a different one, a different product. We can talk about itch in general. Oftentimes when pets are itchy, there's an underlying cause, whether that's a flea allergy or an environmental allergy or a food sensitivity. And our veterinarians can walk you through, we want to treat the itch, and we also want to try to treat an underlying cause. And we can work towards getting to the bottom of that as well.
Moving on to anxiety and behavior, that's Eddie's specialty. And speaking of Eddie, our promo this week is Eddie 50, EDDIE 50, if you want to give that a try and save $50 on your membership. The first question is from Terry Cords Gabriel. Would the online vet prescribe gabapentin for my cat for his grooming appointments?
Yeah, definitely. And I think that's a great use of telemedicine. As long as your cat's otherwise healthy, eating, drinking, peeing, pooping normally, that's like a good scenario of, do you need to bring your cat into the vet clinic to get a prescription of gabapentin? Not necessarily. I mean, we do recommend annual physical exams for pets. But we can prescribe gabapentin for cats for a grooming appointment, especially if they're the type of cat that gets stressed at a grooming appointment. They're probably also the kind of cat that gets stressed going into the clinic. And gabapentin has been like a miracle drug for us as veterinarians, being able to reduce anxiety for these kind of stressful scenarios. So yeah, I think that's a great application.
Jill Pfeiffer asks, I have 2 reactive 11-month-old siblings who were never socialized. My vet said anxiety meds require a behaviorist, which isn't feasible in my area. Do you work with the behavior or just the medication?
This is a great question. I mean, so a lot of behaviorists that I know actually do telemedicine. So they're using it in their own practice. When we're treating anxiety in pets, we use medications, but we also always talk about making sure the pet's generally healthy and behavior modification, meaning like working with them in their environment, working on the behaviors that you're seeing. So it's not that medications are part of the plan, but they are not the plan by themselves. And that's an important part of how we approach behavior for all of our veterinarians at Dutch. So absolutely, we would love to help you out. Veterinary behaviorists, there's not that many of them in the country. And so it's often very expensive to see a veterinary behaviorist. And they might live really far away. So telemedicine is a great tool. I've talked to lots of behaviorists that want us as general practitioners to be working with pet parents and helping with these issues. Telemedicine is a great start. So absolutely, we can work with you and your pets and help them with their anxiety.
Last question on anxiety from Victoria Young. Can a Dutch vet help a cat with depression from the loss of 2 housemates? He's not eating much and being more vocal.
Oh, I'm so sorry. I know that's really sad. And so, okay. So absolutely, I'm sorry for the loss of the housemates. And I think, we underestimate, I've seen this before a lot, when one animal in the household passes, the pets feel that, and I have seen myself like changes of behavior when they're going through that period of loss. So I just want to acknowledge and hold space for that. I think that's really real. I would be concerned if he's not eating and he's being more vocal. I want to make sure that he's systemically otherwise healthy. And so this is a scenario where absolutely you can get on a a call with a Dutch vet, and I think you should, and talk through what you're seeing. It would be great to see some video of him and how he's vocalizing and what he's doing around the house. But if he's not eating very well, that can be a serious problem in cats. And so we would want to work with you to either get some blood work done on him, and talk about things that we could do to make sure that his appetite's normal, because we don't want him going off of food.
So I love this, that we're doing the Dutch live stream and we're getting questions that are live. This comes from Isabella Rodriguez, back to allergies. She said, I definitely love this idea. I have a reactive German Shepherd that a lot of veterinarians will not see. I did want to ask, what is the best thing for allergies? I live in Florida and allergies are killer to German Shepherds. And actually, there was already a reaction to this. Another person said, I swear, a lot of German Shepherd owners, and the child I have, 2 of them myself. So lots of German Shepherd owners on this live chat. I recently moved to Florida and found out the allergies down here are crazy. I've never seen my Shepherd itch so much.
Yeah, and validating that one, allergies are bad in Florida. It's one of the hot spots for environmental allergies and for fleas in the country. So you're not alone. We do see a lot of German Shepherds on the Dutch platform. I can speak to that. They're ranked in the one of the breeds that's very common for us. And I think, they're a breed that they're very smart, and they can have issues with anxiety, and they're also big dogs. And getting a big dog in the car to go to the vet is hard when they're not super excited about it. So you're not alone. I have seen German Shepherds in this situation. We can absolutely help with, we call it pruritus, with itch. We can absolutely help you with itch on the Dutch platform. You'd hop on a call, you get to talk to a veterinarian that's licensed in Florida, and we can prescribe medications to help with itch and also get to the underlying cause. Whether, even though you might not see them, fleas can be a cause of itch. Fleas are really bad right now. If they're scratching at the tail base, like on top of the tail or anywhere kind of around the rump, I mean, that's like table stakes. We should absolutely get you on a flea and tick preventative. And then if they're itchy all over, or it's less in one specific area, I would think about environmental allergies and food sensitivities. And it's really helpful if there's any spots on your pet, if you can take pictures of them. Sometimes we can see things better through a picture than we can struggling with a pet in person. So all that stuff really helps. But yeah, we can definitely help you out. And I empathize with you. Trying to get a big dog into the vet clinic is hard. And then they're so itchy and it's hot right now. So it makes it even worse, I think.
What do you say on this topic to someone who's like, I think they just need a good bath?
A bath can be really helpful, actually. I think about from the heat. So a bath isn't going to address like a flea allergy, and if it's an environmental allergy or a food sensitivity, it's just going to come right back. So I'll say that, like, it's going to help a little bit. It will help from the perspective of like cooling them off, and the cold water actually helps with itch. And then grooming and getting that undercoat kind of released so that they can do their own air conditioning with their coat can be helpful. And then baths, even just washing the paws, removes a lot of environmental allergens if your pet's exposed to environmental allergies and that's what they've got going on. So baths can be helpful, but they are one piece to the puzzle of itch.
Okay, Isabella says, I don't want a medication that just tricks their brain to not itch. Definitely looking for something that heals it. I definitely have plenty of pictures of his skin and how dry and flaky his belly got. We'll be booking an appointment with you. Thank you so much. I never knew that just washing paws could help.
Yay. Yes, absolutely. And for big dogs, like, it's a lot. I had a big dog, so taking on the chore of washing the whole dog is like, it's a lot. So even just the paws can be helpful.
Does the, is that, I mean, the medication tricks the brain not to itch. Is that what the medication does?
So the JAK inhibitors like Apoquel, Numelvi, and Zenrelia, they do block the body's response to itch. So, I don't know that I would to say like it tricks the brain. I think about it actually as like this. My computer froze, so I hope you guys can still see me. Yep, there we go. So I think of that as actually a good thing, because when dogs are really itchy, and I understand, like no medication is without consequence, right? But if you think about the trade-offs there, if a pet is itching and they're scratching at themselves and then they cause a hot spot because they feel itchy all the time, then that trade-off would be worth it. So I think it's a balance between how itchy they are, and those medications can be useful. But ultimately, I like what this pet parent is saying, that they want to get to the underlying cause of the itch, because we address, we can use the medications that block the itch as much as we want, but if we're not addressing the underlying cause, it's always going to be there. So I think both are important. And we can work with people if they want to use more natural methods for, I think there's just more commitment, like maybe more bathing. Yeah.
All right. So we've gone through Dutch and online vet care and how that can help flea and tick, allergies, anxiety. Let's get to chronic conditions.
I just want to call it. It's so nice to be able to help people on these live sessions, Joe. I think this is why I fell in love with telemedicine in the first place, is because I just love helping pet parents that are trying to take care of their pets. Like if people love their pets, I love them.
I know, it's so cool. We were doing customer interviews yesterday, and there was a woman who had, and she was describing the way the Dutch helped her. And I just thought this was so cool, because she was in Arizona and saying how difficult it is to get an appointment. And we've created a service that helped her take care of her dog. And that is, I said to my wife, I was like, this is so cool. We have a service that helped this woman and her dog get care that she otherwise would not have gotten care. Like, how freaking cool is that?
It's so cool, and it's great for the pets, and it's also great for the pet parents. I mean, it feels good. It feels horrible when you can't take care of your pet the way that you want to. So, like calling out the connection between human health, our mental health, and the pets as well. I think it's all really connected. How much, like it feels good to be able to take care of your pets, and I love being able to help with that.
Mm-hmm. Isabella Rodriguez followed up and said, the vet actually prescribed me Apoquel and then cefpodoxime, which helped, but as soon as I'm out, back to itching, and I've been giving him baths with the shampoo Malaseb.
Yes. So it sounds like there was an infection. Cefpodoxime is an antibiotic that treats an infection, and so does a shampoo, actually. Shampoos are great to use because if there's an infection on the skin, because they're treating shampoos and mousses. Mousses can be so helpful too, because especially if you have a big dog, you don't have to bathe them and go through the whole process of getting them all wet. You can just apply the mousse, but you're treating topically where the infection actually is. For oral antibiotics, the bloodstream has to take the medication there. But yes, and then maybe if the itch came back right after stopping the oral antibiotic, then we need to investigate that underlying cause a little bit more. Take a closer look at that skin.
So we are talking to Dr. Kate, Chief Medical Officer at Dutch, on our weekly live stream. And we are at a point where we're talking about chronic conditions. We have a live question from a user who says, what What should I do about cat acne?
Cat acne. Cats can get acne. They can, especially they can get pustules and comedones, like on their chin is a common place to see irritation in cats. And it comes down to trying to determine the underlying cause as well as treating the acne itself. So there are like topical acne medications and antibiotics that can help with acne specifically, but things that cause that are sometimes like dietary allergies or contact allergies, sometimes switching the bowl. If you're using a plastic bowl or a ceramic bowl, I would say switch to a metal and vice versa. So yes, keeping the area clean and dry is also really important. So if you can use a wipe, we have medicated wipes on the platform, and you can keep that area clean and dry. That can be really helpful as well.
Our next chronic condition question comes from George Uring. He says, my dog is on phenobarbital twice daily for seizures. Vets treat this and refill these meds online.
Yes. So I just want to say it's hard to treat dogs with seizures or to have a dog with a seizure. Seizures are scary, and so I'm sorry for what you're going through. Phenobarbital, we have several drugs that we use in veterinary medicine to treat seizures, and a lot of the time, you know, the common thing that we see is idiopathic seizures, so seizures in an otherwise healthy dog that are of unknown origin. Sometimes when we see seizures in older dogs, we will go through a diagnostic workup to look for something like a brain tumor. It can happen in younger pets too, but it's uncommon. But once we diagnose a pet with idiopathic seizures, we'll put them on a medication. And there's different types of medications that veterinarians will choose different ones based on their experience and the specific pet they're seeing in front of them. Phenobarbital is one of the medications that's controlled, so we don't prescribe that one through telemedicine. There are others that we can prescribe, but because of the nature of phenobarb, and it has this narrow window where it has to remain in a certain concentration in the blood, it requires regular blood work checks to make sure that you're giving the right dose, and it's controlled. So we can check in with you and talk through with you about the seizures and what you're seeing and medication choices, but we won't be able to prescribe that specific drug.
Next question from Julie Tatum. My 3-year-old dog had mild stress-triggered seizures when she was younger and was taken off meds after 18 months of being seizure-free. She had one yesterday. Can you start the meds for that?
So I would ask a couple questions about which medication they were on previously and how long they were off of medications before having another one. So I would have a couple of questions, and it depends on the medication. Some of the medications we could restart through a Dutch video visit, but based on how long they were off and the medication they were on previously, we might recommend seeing a veterinarian in person. So there's a couple more questions that I would ask as a follow-up there. Yes.
Last question on chronic conditions and telemedicine from Lexi Array. My dog has a neurological disorder and is on gabapentin and NSAIDs to manage symptoms. Is this something you'd be able to prescribe upon regular virtual visits?
Yeah, definitely. So I'm curious which neurologic condition, but definitely being on a nonsteroidal anti-inflammatory and gabapentin for a neurologic condition, yes, we can prescribe those. And I think using video analysis, so recording videos, I've worked with neurologists throughout my career a lot, and actually having videos of how pets are walking and moving at home is really important. So we can take a look at those through the Dutch platform. You can send a video to the veterinarian you have a visit with, and we can make a plan there.
And we have time for a couple more questions. I love, like you said, Dr. Kate, we get to help pets every day, but I love these live questions on our Thursday live stream. Telemedicine is so new and so many folks have questions how it works. This one from Catherine Beecher, she says, I love the idea, but how can you assess a dog if you can't actually physically touch it and check vitals? This is a common question.
I get this question a lot. And so there is a lot that we can do virtually. And I want to be clear and say, like, I physical exams are great. And my vision of veterinary medicine in the future is that every pet has a vet that they see in person and they have a vet online. Because I think we work together really well. And there are scenarios when pets don't need to go into the vet clinic, or even being able to see them at home is better. And so a lot of what we do as veterinarians is understanding and assessing history, and a lot of the exam is visual. Some parts of the exams of pets are, putting our hands on the pet, and depending on what that is, the veterinarians on our platform have years of experience, and they're going to know and be able to say, hey, this is something where a veterinarian really needs to put their hands on a pet and they need to be seen in person. When it comes to vitals, I feel like we get a better respiratory rate when I'm seeing a pet virtually, because they're not like panting. And being able to get a heart rate, like we can talk a pet parent through how to get a pulse on their pet. And then temperature that one is a little bit trickier, although sometimes in vet clinics too, we do see elevated temperatures, which we presume they're due to stress. And so anytime your vet online thinks your pet has a fever, they're going to recommend going in person. Any signs of fever means an in-person visit, if that's at all doable for the pet parent. So it's a great question. And I think actually one of the most important things that I can do, and what I was trying to do, I was at the AVMA conference. Our American Veterinary Medical Association had their annual conference list last week. And one thing that I want to do is teach veterinarians and teach pet parents about virtual care and how to use it and how it can be a great tool, because we should all be working together to provide the best pet care that we can and to allow access for that. Because 52% of pets in the US are getting no veterinary care, and telemedicine is a great way to help serve them, and education of when to use it and when a pet needs to be seen in person. Like those are the important things. So asking these questions are great. Understanding, when we use telemedicine and when pets need to be seen in person. These are great questions. And I think one thing also that we forget is we don't give pet parents enough credit sometimes. We treat, our stats show how, Joe, I think it's like 90% of the pets that get on the Dutch platform have their issues or their conditions resolved. And when I think about why that number is so high, a lot of what I think about is because we're not giving pet parents enough credit. Like, they know if their pet is continuously vomiting, then they need to go into a clinic. Or if their pet's really showing signs of a fever, most pet parents have a sense of that. Versus when a pet is itching, or they want to discuss diet or behavior issues. Those are great uses of telemedicine. So yeah.
We have a couple more telemedicine questions. I have a senior dog, 60-pound golden retriever, blue heeler mix. She's not walking and jumping much and seems to be in pain. She's not walking and jumping much and seems to be in pain. What is your typical approach in these situations?
I love senior dogs. What a sweet, it sounds like a really sweet dog. Okay, so I would have some questions for you. Like the first thing I love to do on a telemedicine appointment is take a look at the house and watch your pet move. Because yes, if they're in pain, we would love to get them on a pain medication that helps them be able to move and kind of keep their joints comfortable. So yeah, we would address the pain and we'd look at the house and the main patterns of movement and make sure that there isn't like hardwood floors or tile for them to slip on. Like I love carpets and yoga mats. It's definitely a fashion statement or like a interior design statement putting those down. But sometimes they might not be walking because it's slippery. And so having that traction down, making your house like less like an ice rink and more like a gym floor is what I say, can be really helpful. If, you know, as long as they're eating and drinking okay, that is a really important piece. Sometimes like elevating the food bowls so they don't have to stretch down, that can be helpful. And making sure that their quality of life in their environment, like if they have to jump to get on a couch, I'll recommend putting a ramp there. Or if they love to hang out on a bed, we want to reduce the amount of times that they're having to jump up and down. But yes, we would talk about lifestyle, you know, lots of short walks, but multiple walks throughout the day, instead of trying to do one big walk on the weekend. We would talk about diet and nutrition. We talk about body condition and weight. Those are really important things, especially in a larger dog. Yeah.
Okay, we only have 3 minutes left.
Okay.
One of our last questions. I have an 11-year-old GSD that has early stages of degenerative myelopathy. She was genetically tested and she was a NA carrier. She crosses her feet when she walks. Is she feeling pain?
So generally, no. So German Shepherd dog is GSD, and degenerative myelopathy is a condition commonly seen in these large breed dogs, and so no. Generally, these dogs that have this neurologic condition, which it's comparable to ALS in humans, it causes like a loss of function in the hind limbs and kind of like weakness and wobbling. Sometimes you'll see they'll look like a drunken sailor because they're crossing their legs and they'll stumble. But this condition is not really thought to be painful. So they're not experiencing pain if they've been diagnosed with this condition. Things that I like to do to help them though, because they will eventually lose control of their hind end. So going to the bathroom can be really hard. Keeping them clean in that area can be really hard too. I like help them up harnesses and then using like bath towels underneath their abdomen to kind of help keep them up when they're going to the bathroom. Those things can be really helpful. But no, they're not experiencing pain. And that crossing of the back feet is very common in those kinds of dogs. Keeping them moving and keeping the muscle mass there can be really helpful. Yeah.
All right, we have time for one last question on our Dutch live stream. Otherwise, we'll be back next week. This question is from Lisa Lewis. She says, my dog is super hyper around people and very difficult to treat because of that. We have to drug him just for the car ride. Would this work? And I'm guessing, would Dutch or would telemedicine work for a dog like mine?
Yes, definitely. This is an example when seeing a vet online would be a great option, especially like a great first option for your pet. So if they're nervous and hyper around people, starting with an online vet where you can talk to a vet through video, just like we're doing right now. Eddie was on the screen before, but yes, we would have you hold your pet up to the camera and do an exam that way. If the veterinarian says, hey, there's something specific that we want you to go in person for, they will call that out. But a lot of conditions we can treat through the video exam where we establish VCPR. and get to know your pet virtually, and can diagnose and prescribe that way.
Awesome. Well, this has been another episode of the Ask a Vet Dutch live stream. We have our promo code Eddie50 if you want to check us out. And Dr. Kate and I will be back next week, Thursday in the morning. And please send us your questions ahead of time or on this live stream. And we look forward to seeing you next week. Bye.
Bye. Great to see you guys.